Hello everyone. Today I will introduce embolic stroke with the case of Miss Teresa Milo. She was admitted to the hospital due to atrial fibrillation and was originally scheduled to be discharged the next day. However, she suffered an embolic stroke that night. I will explain it in three steps. First, the A2E assessment. Secondly, the four priority nursing interventions. And finally, the nursing precaution for three types of drugs. Through my explanation, I hope you can have a deeper understanding of how a nurse should better care of patients with embolic stroke. First, the A2E assessment. Airway, the patient's airway is currently unobstructed. However, due to the GCS score of 12, there is a decrease in consciousness and unclear speech, which may indicate the risk of airway obstruction. Additionally, stroke patients often experience choking and aspiration. Therefore, the nurse should always ensure the patient's airway is unobstructed. Position the patient in a semi-sitting position and have suction equipment at the bedside. Special attention should be paid to patient's airway during the eating and drinking. Breathe. The patient is currently receiving 6 liters per minute of oxygen through a Harrison mask with a respiration rate of 26 breaths per minute and a blood oxygen saturation of 95%. The patient's rapid breathing indicate insufficient oxygen supply and a risk of developing hypoxia. Therefore, oxygen should be continuously supplemented, maintaining oxygen more than 95% and observing the patient's chest for signs of assisted breathing. Circulation, her heart rate is 136 beats per minute and blood pressure is 118/98, both above normal levels. This is due to the increased cardiac burden caused by thrombosis. The nurse should continuously monitor ECG, heart rate, blood pressure, and ensure the availability of intravenous cannula in case of emergency. Disability. The patient's GCS is 12 or 15 with a left limb weakness and unclear speech. This is a typical sign of stroke. Nurse should frequently assess the patient's level of consciousness. For example, whether the patient can respond to stimuli, whether the patient can answer questions, and whether the patient can perform actions as instructed by the nurse. Various vital sign information can also provide an indirect assessment of patient's overall consciousness. Exposure. The patient's current body temperature is normal, but a full body examination is still necessary to prevent the wound or bleeding. Subsequent thrombolytic drug may be injected, so ensure that the patient does not bleeding. Additionally, ensure the patient is at an appropriate temperature to promote cold-induced aggravation of the stroke. IVC is on the left cubicle fossa. For four priority nursing interventions, the most important first step is frequently neurological function assessment. According to the research by Yu et al., the condition of stroke patients change rapidly, and in severe cases, there may be cerebral hemorrhage or worsen of blockage. Nurse should assess the patient's GCS every 15 minutes, observing speech disorders, limited limb movement, and changes in pupils. Early detection can effectively prevent further cardiac damage for the patient. And the second point is to prevent aspiration. Zhao et al. Research indicate that aspiration pneumonia is a major complication of stroke. Therefore, a speech therapist should assess the patient's swallowing ability and keep the patient fasting until the assessment is completed. During the eating process, patients should be adjusted to semi-sitting position. The third point is blood pressure management. Currently, the patient is in a state of hypertension, and it is necessary to gradually lower the blood pressure. Soon, found that hypertension increased the risk of cerebral hemorrhage, but lowered too quick can lead to a cerebral ischemia. And therefore, it is necessary to gradually lower the blood pressure, monitor the changes in blood pressure in a timely manner. The fourth step is pain management. Stroke patients often experience complication and pain due to inability to move normally. Effective pain management can improve the patient's health status, reduce psychological stress, lower blood pressure, and thereby better assess the patient in recovery. Therefore, nurses should regularly assess the patient's pain level and promptly provide the doctor with prescribed painkiller and other assistance. Finally, the key points for care of the three main drugs are as follow. First, I would like to point out that the IV alteplase as a thrombolytic drug can dissolve the blood clots in the block of that block the blood vessel. However, one of the most serious side effects of this drug is cerebral hemorrhage. Therefore, before administering this drug, a CT scan should be performed on the patient to rule out the possibility of cerebral hemorrhage. After administration, the patient's vital signs and mental state should be observed frequently to prevent cerebral hemorrhage. Rosso et al. Points that the earlier this drug is used, the better the recovery effect of patient will be, but the risk of bleeding is also higher. Secondly, the heparin IV infusion. As an anticoagulant drug, it is used to prevent formation of new blood clots. The side effect of heparin also induce bleeding. During the nursing process, nurses should pay attention to whether the patient's wound, gums, and excretions are bleeding, and remind the patient to avoid injuries. Study has shown that also heparin can reduce the formation of new blood clots. It also increases the possibility of bleeding. Therefore, nurses should communicate with doctor in a timely manner about the patient's condition and adjust the dosage promptly. Finally, this drug is mainly used to control heart rate and lower blood pressure. Therefore, when administering the drug, nurses should pay attention to whether the patient has symptoms such as bradycardia, hypertension, dizziness, and fatigue. At the same time, asthma patients take this drug may cause bronchoaspirate. Diabetic patients use this drug may mask symptoms of low blood sugar. Therefore, nurses should understand the patient's health background before administering the drug to prevent unexpected incidents. Thank you.